I would like to share with you the experience on how the challenge of antimicrobial resistance requires a number of digital tools, the integration of a number of digital tools to be addressed, and how this impacts training and education strongly in our experience. So the issue is very relevant to public health worldwide, and the numbers speak for themselves. We have almost 5 million people dying by diseases where antimicrobial resistance organism had a role, and almost 1.5 and 3 million people dying as a direct consequence of antimicrobial resistance. And we need to strengthen the way we use technologies to anticipate diagnosis. We need to share a number of data about drug resistance worldwide, and also we will see across sectors. And we need to have a better reporting and communication system. If you look at the sectors across which antimicrobial resistance drivers and hotspots lie, the challenges look even broader in terms of sharing data, because they go from agriculture. The data need to be shared across agriculture, animal husbandry, households, and human health and industry, because all these environments produce as a waste antibiotics that put a pressure over the microbes, and they can select resistance that is spread from one microbe to another, and it is not withhold across boundaries. So why can we now implement and even think of an integrated approach to address antimicrobial resistance challenge? Because we have enabling technologies now, and digital technologies especially have been developed to an extent that they can really make a true change in the management of antimicrobial resistance. But we need also to bring about at the same time not only the implementation of these digital technologies in our current practice, but also we need to complement this integration with organizational adaptations and supported by adequate education and training. We know that there are a number of rapid and accurate biotechnologies that we can implement. We can adapt these technologies to different healthcare settings. We can integrate them in the professional routine. And we also need to implement a number of selections in the information, in the workflow of information that we make available to the right professionals across all these sectors that still need to interact. So we have to improve our capacity to manage these huge workflows, and also we need to store data on patients in a way that it is accessible to allow secondary use of data that is targeted in a networking system. So there have been a number of investments, not only through European projects, but especially by all the professionals and organizations that have been making huge efforts in these projects to address challenges such as capacity building, the gap between what is the declarations and the recommendations and their implementation in actions, and between research products and their implementation in the real current service provision. And we know that training plays a pivotal role at the boundaries of those results across projects, because this training is an enabler to strengthen the integration of surveillance and environmental monitoring. Training can strengthen the prevention of healthcare-associated interventions in hospital and communities, and can strengthen appropriate use of all antibiotics across sectors. You don't need to go through this slide. I just didn't have the time to simplify it, but this is the story of a use case that we have been dealing with. And trust me when I say that the integration of digital solutions in the journey of this patient can make the difference between life and death. It makes the difference between having an outcome that is not favorable against full recovery. And this is just to have a closer look to the figures that are involved in the implementation of these digital solutions, to give you an idea of the complexity of the training across sectors. For example, this is the hospital setting where we are trying to address the antimicrobial resistance challenge, and only across in the hospital you can see that there are a number of specialists in the clinical domain. There are nurses with different background. There are clinical microbiologists, lab technicians, the pharmacists involved, and in order to for an integrated IMR management system to be implemented, all these people need to be trained together, and we are only looking at the hospital sector. So the nurses are from different settings, the clinicians are from different specialties, and the point of care that are among the technologies we are implementing are not in the lab, but they are in the clinic. So this all adds on to the training needs that we need to implement all together. We carried out a training that taught us that we need to be very focused and sharp in the training. These are people that are involved in the process where in the clinical processes where antimicrobial resistance is more is making more damage. So they are all aware. So you need to provide to be very focused on the training you deploy. And if people are involved since the beginnings in the design of the implementation of the technologies, they come to the training and they learn. So we had a pretty successful training that was completed a few weeks ago, and more than 90 professionals from 12 different clinics adhered, including nurses, technicians, and doctors, and they all participated because they were identifying that the impact of digital solutions could have in their daily routine. This is something that also was pushing the organizational processes inside the hospital, because it was clear that it was an effort from a team. It was not so it was like a technology-driven reorganization that was pushing towards process organization where a team was working together. And this is also something that we are thinking to implement from the Team Care project. This is another European project that we could use in the future to strengthen the implementation of innovative solutions to address antimicrobial resistance, because this project is just outlining which are the integrated framework of competencies for interprofessional teams. And if we look at this framework, you see that digital health and the related vertical training content is complementary and to the other element of the framework, and facilitates the interprofessional communication and shared vision. So just a final look at the syllabus, some keywords from the syllabus of Team Care, and we see collective leadership and interprofessional decision-making, team collaboration, performance and dynamics, interprofessional conflict management resolutions. These are all elements that are the key to facilitate the integration of digital solutions and innovative approaches into routine daily care, and finally ensure that digital solutions are scaled up. What is emerging is a different value chain where we see that integrated information systems are the nest where primary, secondary, and support activities are integrated. This is a work in progress, but is based on daily experience. We use it as a reference and we modify it. And this is just to give a face to the people who have been involved. And let me tell you, this is an iterative process, because in the beginnings it was just for people, but iteratively during the implementation we realized that there were many more skills and backgrounds and competencies that we needed in the hospital to ensure that such a complex challenge and so different digital solutions could be implemented and in the real life.